Hello, my name is Morgan Lima. I am a registered nurse and I have partnered with Picmonic to bring you this video on pre-exposure prophylaxis. You can find me on Instagram at The Teachable Nurse or my website at www.theteachablenurse.com. This video is going to dive into medications used to prevent HIV and how they do this through their mechanisms of action. Pre-exposure prophylaxis, more commonly known as PrEP, is the treatment used to prevent the transmission of HIV-1. It comes in multiple forms, including oral and injectable. PrEP is effective at preventing the transmission of HIV, or the human immunodeficiency virus, through sex by 99%. For people who inject drugs, PrEP is approximately 74% effective at preventing the transmission of HIV. When someone first begins to take PrEP, it will take from 7 to 21 days for it to reach its full efficacy in the body. It is crucial that people taking PrEP take it consistently as prescribed to maintain that therapeutic drug level in their system. People who can benefit from PrEP are anyone who has sex with more than one person. Patients may present to their primary care clinic requesting PrEP because they are in a new relationship or are in sexual relationships with more than one person. HIV-negative patients who are in a long-term relationship with someone who does have HIV may request PrEP. Several mixed status couples, meaning a seropositive HIV status and seronegative HIV status, they'll have prescriptions for both their ART, antiretroviral therapy, and for PrEP. It is important to understand as a nurse that anyone can benefit from PrEP, not only those who are at a perceived risk for contracting HIV. Patients may not always verbalize their reasoning for wanting PrEP, so it's important to complete an in-depth sexual history to best understand how to monitor and teach the patient receiving PrEP. PrEP does not prevent the spread of other sexually transmitted diseases like syphilis, gonorrhea, chlamydia, etc. Therefore, it is crucial that patients still use protection, such as condoms, when having sex if they are at risk for other STDs. The first option for PrEP that I'll be discussing is called Truvada. Truvada is a combination of tenofovir, disoproxil, fumarate, and emtricitabine. It is a one-pill, once-a-day regimen, FDA approved in 2012. That tenofovir disoproxil fumarate is also known as TDF, and that's what I'll be referring to it from now on. And emtricitabine is also known as 3TC. So TDF and 3TC are Truvada. TDF and 3TC are nucleoside reverse transcriptase inhibitors, or NRTIs. That means that they work to stop the third step of the HIV life cycle by blocking the conversion of HIV RNA to HIV DNA. Prescribing Truvada as PrEP became standard practice thanks to 3 studies that were conducted. These showed that it greatly reduced someone's risk for contracting HIV if they took the pill as directed once a day, preferably at the same time every day. Those who reported poor adherence were more likely to become HIV positive. Common side effects of Truvada that you'll want your patient to be aware of include fatigue, nausea, vomiting, dizziness, bone pain, insomnia, and elevated cholesterol. Adverse effects, which are typically more rare and more urgent than common side effects that you should look out for, include liver failure, which you can tell by the yellowing of the eyes is usually a sign that you can tell right away. Then you would follow up with a liver enzyme test. Other adverse effects include decrease in bone density, so osteopenia, osteoporosis, can cause lactic acidosis, symptoms of depression, kidney problems, and worsening of a hepatitis B infection. So labs are monitored every 3 months while a person takes Truvada to ensure that these adverse effects are not happening. They also check labs every 3 months to make sure that no one has contracted HIV while taking Truvada. And I'll discuss more in depth what laboratory values are monitored a little later. It's extremely important to check for HIV infection consistently while taking Truvada, because if someone develops HIV while on PrEP, they may become resistant to the components of their PrEP regimen. So speaking of multiple regimens, another option for PrEP is called Dyscovi. Dyscovi is a 1-pill once-a-day combination containing 2 NRTIs, so tenofovir alafenamide and emtricitabine, also known as TAF, TAF, and 3TC. Dyscovi was FDA approved in 2016 after successful clinical trials, including the Discover study, which was a phase 3 study that compared the efficacy of Truvada and Dyscovi as regimens used as PrEP. This study showed that Dyscovi worked just as well as Truvada in preventing HIV. Dyscovi's side effects are similar to Truvada, but there is evidence that Dyscovi should be used in people with concerns for kidney function and bone health, since it is less likely to cause those adverse reactions related to renal and bone health than Truvada is. People taking Dyscovi may have greater increases in LDL cholesterol, so that low density, the bad cholesterol, than taking Truvada. So there may be an indication to choose Truvada over Dyscovi for someone with baseline elevated triglycerides. TAF and 3TC are also NRTIs, so they work the same way Truvada does and blocks that third step of the life cycle, the conversion of HIV RNA to HIV DNA. The third and most recently FDA-approved option for PrEP is Cabotegravir. Cabotegravir is a combination of cabotegravir and rilpivirine. Cabotegravir is a non-nucleoside reverse transcriptase inhibitor, or NNRTI, which blocks the conversion of HIV RNA to HIV DNA by binding to the reverse transcriptase and inactivate its attachment site. Rilpivirine is an integrase strand transfer inhibitor, meaning it blocks the insertion of HIV DNA into the CD4 cell DNA. Cabotegravir is given as an intramuscular injection, so usually in the gluteal muscle as 2 injections, cabotegravir in one and rilpivirine in the other. It's given once a month and also used for the treatment of HIV in people who are currently adherent to their oral regimen and consistently have HIV viral loads less than 50 copies per milliliter, meaning their virus is so low that it is undetectable on a blood test. Now, there are many prerequisites that patients requesting PrEP need to meet. Firstly, patients must demonstrate good adherence to their daily medications if they currently take any. Taking PrEP at the same time every day without missing a dose ensures that therapeutic blood level, allowing PrEP to work to its fullest potential. Logistical considerations include patients having reliable transportation to and from clinic appointments. If they receive Cabotegravir for PrEP, then they must go to the clinic more frequently than if they're prescribed oral PrEP, like Truvada or Dyscovi. These patients may need to come to the clinic every 3 months or every 6 months, depending on how well they are tolerating PrEP and how long they've been on it. So why do patients need to come in so frequently? Other than checking to see if the patient is having any side effects, the main reason patients need to be seen so often is because they need to have their labs drawn to check several values. One of these, as I mentioned previously, is an HIV RNA test. This is a blood test that will detect HIV if it is present in the bloodstream. It is important to check this when a patient is on PrEP in case that person does contract HIV. Then the patient will transition from pre-exposure prophylaxis care to HIV treatment. And that treatment usually includes another class of drug added on to the ones that they're already taking for PrEP. Another lab value that's important to look at is kidney function. There is evidence that some components of PrEP, such as the tenofovir disoproxil fumarate in Truvada, can cause kidney problems in some patients. A lipid profile is also drawn to monitor the patient's triglycerides, high-density lipoproteins, and low-density lipoproteins. This is important because there is evidence that some components of PrEP, such as the tenofovir, alafenamide, and Dyscovi, can contribute to higher lipid levels. Finally, a hepatitis B panel is drawn to ensure that patient has not developed hepatitis B while on PrEP. This is because some components of PrEP, such as those in Truvada, are also used in treatment for Hep B. Therefore, patients should be sure they are not becoming resistant to any future treatment for hepatitis B, just like they are for HIV. I won't go into too much detail about the medical coding side of PrEP treatment, but it is important to note that getting that ICD-10-CM code correct when it comes to assigning them to PrEP labs and PrEP treatment is extremely important in order to ensure that insurance covers these. ICD information is available online for providers in charge of prescribing PrEP. Patients can ask their primary care provider for PrEP, or they can go to their local health department, or if they live in an area with HIV specialty clinics, they may go to one of those. Unfortunately, there are many areas of the United States that do not offer PrEP care, either because of a lack of providers willing to prescribe or knowledgeable about PrEP, or because lack of funding or resources in these areas. These areas are known as PrEP deserts and are primarily common in the South. A resource to offer patients living in a PrEP desert is online PrEP prescribing or telehealth services that offer PrEP without needing to be seen in person. The last topic we will discuss is discontinuing PrEP. There are many reasons a patient may want to come off PrEP, whether they don't need it anymore because their lifestyle has changed, or they're unable to tolerate it. If a patient wishes to discontinue PrEP, they must speak with their provider first. It's important that they know that the therapeutic drug levels of PrEP in the bloodstream decrease over 7 to 10 days. There is a risk for contracting HIV right after stopping PrEP, so some clinical implications include monitoring the patient and bringing them back for follow-up visits, as well as providing education on prevention of other STIs. This concludes this video on PrEP. I hope you learned some important information that you can share with your patients. Thank you.